How'd you get here?
By osmosis.
No helmet?
Didn't seem like riding weather.
And the fact that you can barely stand upright had nothing to do with it?
Infarctions hurt. That's what you do.
Worsening pain could actually be a good thing. Means the nerves might be regenerating.
Could be good, could be bad. Thanks for the differential. Any other options?
Have you ever considered a career as a motivational speaker? Why don't you check out some
I
rehab?
did the rehab thing.
One session. And you didn't even finish that session.
The guy wanted me to visualize the healing. I can do that at home.
At least let me get you an MRI.
It's a very simple equation. More pain, more pills.
Teenage supermodel. Presented with double vision, sudden aggressive behavior, cataplexy.
You had me a teenage supermodel. Okay? Wow. You should be a model. Are you really 15?
Who are you?
I'll be the one saving her life today. Assuming she's dying. Who are you?
He's my father.
Any idea what's wrong with her?
Well, from the looks of it, not a single thing. Probably should stop staring and check out the file. So what set off the brawl? Did she stand in your light?
I didn't even know her. I didn't know what happened.
Look, I know some models are notorious for hissy fits, but Alex, I've never even seen her get angry. Even when she was a kid,
Sure, she was delightful in her youth. Then you passed out.
I was passed out, but I wasn't. I knew what was going on, but I couldn't move or talk.
Yeah, it sounds like a medical thing. It's called cataplexy. Cat fight and cataplexy on the catwalk. Cool. How much were you drinking?
She only had one sip of champagne.
Forget it. I'll find out from the top screen.
All right, look, I gave her a Valium. You think that's what did this?
No. How long have you had the sweats?
Couple of days.
Any other complaints?
My stomach's been bothering me, and I've been feeling a little nauseous.
Okay, here's how this works. My lackeys will be by shortly to draw some blood, collect some urine, any other fluids you got. I'll do some other doctorly stuff, and we'll be in touch.
Labs show Valium and heroin in her urine.
Supermodel on smack. Shocker.
Oh, Alex, I expected so much more from you. Heroin chic is so 5 years ago.
Okay, let's start crossing out withdrawal symptoms.
Positive test means she tried it once. Doesn't mean she's an addict. She's only 15.
There's no age limit on addiction.
He's right.
She's never menstruated. Sounds like a symptom of drug addiction to me.
Or bulimia, or her age. Some girls don't start till they're mid to late teens.
Evidence to the contrary. The rounded hips, perfectly sculpted, bountiful breasts.
Implants. I've seen some of her photos. They've grown dramatically since last summer.
Symptomatic of turning 14. 2 clinic hours says that those love apples are handcrafted by God.
Oh, I thought you didn't believe in God.
I do now.
You're wrong.
Could we talk about her health instead of her breasts?
Could be relevant. Come on, Cameron, there's nothing to be ashamed of. Many women develop breasts. No, I'm fine.
Even if she is an addict, a lot of her symptoms, the cataplexy, the violence, they could be neurological. We chalk this up to drugs, we could be releasing her with juvenile MS or Parkinson's.
Detox
or...
her.
Fine, we'll set her up on a program. They'll wean her onto the methadone.
And in 4 weeks, we'll know you're right. Or we'll know that Cameron's right and the pretty girl will do Milan next fall in a wheelchair. Put her in a coma, pump her full of naltrexone, cut the 4 weeks to 1 night.
Lab reports show that your daughter had heroin in her system. Were you aware of her drug use?
No.
We think she's suffering from withdrawal symptoms. Detoxing generally takes several weeks. The danger is that if the drugs are masking some other illness, it could worsen before we've weaned her off the heroin.
Well, how much worse?
We don't know because we don't know what's wrong. There is a rapid detox procedure. We flush her system with an opioid antagonist. It'll end her addiction overnight. The process is dangerous because we have to induce a coma. It also means that if she ever relapses, there's a good chance she'll overdose because her body won't react to the drug.
So either way, I'm risking her life. you have to tell her how dangerous it is?
Is it dangerous?
There are certain risks. We've gone over them with your father.
And he's not worried?
He's your dad. He's always gonna worry. But he knows we're gonna take good care of you.
Everything's starting to hurt. My legs.
Heroin withdrawal is an extremely painful process, but we're going to put you to sleep. You won't feel a thing.
Promise.
I promise.
It's a pretty stupid thing to do, huh?
Getting hooked on drugs? Yeah, not the best move you've ever made.
I thought it would be fun.
You don't have to explain to us.
A lot of the other girls weren't.
When you wake up, you'll feel a lot better.
Son of a bitch! You killed her!
She's not dead.
She had a heart attack.
She's stable now. The anesthesia.
Get her out of that coma.
Don't think so.
Stop this. All right, I don't consent anymore. I want to do the slow detox.
Did you ever get a paper cut? Really nasty one between the fingers. Multiply that by about 1 billion. And you'll just barely approach the kind of suffering she'll experience if we wake her up now. We're committed to this. She's out till morning. Go get a book.
Shouldn't she be awake by now?
It's only been half an hour since we stopped the medicine.
Well, you said that's how long it would take.
I said it would take about half an hour.
But couldn't this mean something more?
So far, it means nothing.
She had a heart attack. She could have brain damage. She could have something more.
She's opening her eyes. Alex? You okay? Can you hear me?
I got the cute doctor.
Do you feel any pain? Good. Let us know if anything changes. If your stomach doesn't feel right, anything. Hey.
Are you mad at me, Daddy? I let you down.
No, not at all, sweetie.
I should have been more mature. I should have handled the pressure.
Stop. We're gonna get you better, all right? Nothing else matters.
Excuse me. I've got you on what we call a banana bag. Plenty of vitamins, nutrients.
I got the cute doctor. Are you mad at me, Daddy? I let you down.
What's going on?
I should have been more mature. I should have handled the pressure.
What's wrong with her?
We're gonna need you to keep still.
I am.
What do you think that means?
It's either neurological or psychological. The only thing we know for sure is it's gonna screw up the MRI results, which is gonna make House think he's right.
This is a waste of time. Let's just get the LP.
I should take your head off.
Your glands are fine. See, now you're my patient. You got doctor-patient confidentiality. No worries. So, what did you do to her?
Why would you possibly
Hard
think?
to imagine anyone not wanting to nail her. It's a compliment. Heart-shaped ass, those perfect, perky, all-natural breasts.
That is my daughter you're talking about.
No, that's your daughter you were talking about. She just instinctively knows how to walk. Designers just love that heart-shaped ass, those perfect, perky...
I'm her manager. I have to promote her.
Oh, that makes sense. So you compartmentalize. When you're dealing with the press, you're her manager. When you're helping with homework, you're her dad. When you're making sweet, sweet love, you're her manager.
All right.
Do you love her?
I have never touched her.
Do you love her?
What are you doing? You trying to trap me into saying...
Do you love her enough to admit that you slept with her? Psychological conditions can manifest themselves in physical problems. Sometimes these can be extreme enough to kill. There are treatments, but only if there's a diagnosis. Are you going to admit that you slept with your daughter, or are you just going to let her die?
One time.
We have to call Child Protective Services.
Doctor-patient confidentiality.
Doesn't apply in abuse cases, you know that. We're mandated to report sexual abuse.
Is it okay if I save her life first? Or do you want to make sure that Daddy doesn't get visitation rights to the gravesite?
Okay, elevated proteins in her CSF could mean dozens of different things. Viral encephalitis, CNSV.
Creutzfeldt-Jakob disease?
So we're just gonna leave a child molester in the same room as his victim?
It's got windows. Fine, arrest him. Use Cuddy's handcuffs.
If you're too distracted to deal with this because your leg hurts, then...
Yeah, I'm distracted. I'm all hung up on this 15-year-old patient who's cataplectic, can't remember what she had for lunch, and is rapidly losing control of her body. And I want her father here in case they got any more secrets that I need to know about. Now, if you're not too distracted, go take out a piece of her brain, stick it under a microscope. Wilson!
Whoa, 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 whoa. You really think we need to jump straight to brain biopsy?
Nope. Let's continue playing pin the diagnosis on the supermodel until she's dead.
We're gonna do something called a burr hole biopsy. We drill a small opening in the back of your skull.
Doctor, maybe you and I should talk about this first.
No,
I just think Alex doesn't need to be overwhelmed right now.
I think she should have a say in what happens to her body. We're gonna remove a small piece of brain tissue.
Do you have to shave my hair?
Hair grows back.
I guess I won't remember anyways.
There's a good chance the amnesia is only temporary.
Okay.
What did the biopsy tell you?
Wasn't definitive.
But the twitching should stop right about now.
Oh my God.
Could have just been a coincidence. Twitching does tend to stop at start. Let's be sure. The IVIG vacuums her blood, neutralizes the stuff that's making her twitch. It's actually kind of cool. Wonder if I could make you dance.
Enough.
This is unbelievable. You did it. You fixed her.
No. All I did was prove that she has cancer.
Hang on. Hey, who's in charge of the backdrop? Naomi.
Yeah.
What's wrong with it?
Well, the words are completely jumbled. What? You can read that?
Of course. You okay?
No. Oh, God. I could be having a... what's the mnemonic? F is for face. Is my smile crooked?
What are you doing?
A is for arms. Arms.
You should really sit down. Can someone get us some water?
S is speech. I'm slurring. I'm slurring? Huh? F-A-S-T. T is time. Hurry, somebody, call 911. Tell them the vanished truck.
Welcome to the world of maternal mirror syndrome. Mom's body is like an intricate German metro system. All the trains run on time. When she gets pregnant, it's like a new station opening in Dusseldorf. Bunch of rookies running things, bound to be mistakes. Kids playing the tracks get electrocuted. Before you know it, trains are backed up all the way to Berlin, and you get a bunch of angry Germans with nowhere to go. We all know that ain't good for the Jews.
Who are the Jews in this metaphor?
A few things can happen to a fetus in distress. It can become a miscarriage, stillbirth, very sick baby, or on rare occasion, a time bomb. It kills mom while it's dying. Good news is, we fix the fetus, mom gets better. It's the diagnostic equivalent of a 2-for-1 sale.
You said sedation was risky. This sounds insane.
The injection goes into the umbilical cord.
The baby won't feel a thing.
Fetus. I'm lowering expectations. It works here and on dates. The benefits outweigh the risks, and the paralytic will wear off in an hour, okay?
Must be easier to hear you might die than your baby might die. But if there's anyone I would trust to save my baby, it would be Dr. House.
Fetus.
There's a blockage in the urinary tract. Simple terms, your baby can't pee. His bladder is swollen and it's crushing his lungs.
Well, can you fix it?
We can insert a small tube in the baby's bladder that makes the urine come out straight through his belly for the duration of the pregnancy. The bladder decompresses and the lungs will be able to develop normally. When the baby gets better, you should get better. First, we just have to do a test to determine whether the baby's kidneys are functioning properly.
And what if they're not?
If they're already too damaged, then there's really nothing we can do.
My stomach is killing me.
It's not a stomach.
Can you open your eyes, Emma? I just need to take a look.
The swollen bladder was not the only problem. You can't leave it inside you. We have to terminate.
Well, can't you deliver him? Put him on a respiratory machine till you figure out what's wrong.
We can. It won't matter. The fetus is still at least 2 weeks away from being viable.
Oh, well, I'll suffer through this for 2 more weeks then.
You're on dialysis for your kidneys. Your kidneys can wait. They don't make dialysis for your liver. You're not gonna make it 2 more days.
I'm not gonna let you kill my baby.
It's killing you.
I'm not having an abortion.
It's not a baby, it's a tumor. I understand dying for a cause, sacrificing your life so your child might live, but that's not the choice here. Either it dies or you both die.
Or you fix him and we both live.
I can't fix it. I'm scheduling a D&C.
I won't consent. So I guess you have 2 days to figure it out.
What if our original assumption is wrong?
It isn't.
If we assume she doesn't have Mirror syndrome, then terminating her pregnancy isn't going to help her liver at all.
We eliminated all other possibilities.
The fetus is hydropic and in distress. Emma's kidneys and liver are failing. The diagnosis is solid.
Wow. The ass kisser won't agree with you. You must be even wronger than I thought.
Fine. Let's assume she had Mirror syndrome, but we fixed it when we fixed the baby's bladder. That means that her failing liver would be completely unrelated. If it is, we can fix it, and we don't have to terminate.
So her theory is that our patient's liver problems were just a giant coincidence.
It's not a surprising coincidence. Pregnant women can develop liver problems. If this is the case, we can actually do something here. Don't you guys think that's worth exploring?
Acute fatty liver of pregnancy would have the same symptoms.
Thank you.
Brown noser.
Viral hepatitis, HELP syndrome.
Oh, look. Sticking up for your girlfriend. Who says chivalry's dead?
We were able to control the preterm labor with tocolytics. The contractions have subsided for now.
And the liver biopsy was negative. This is definitely Mare syndrome. Her baby's doing this to her.
We're out of options.
Did the biopsy cause the preterm labor, or did it happen on its own?
It doesn't make a difference.
Preterm labor can be a new symptom. New information gives us new theories. Isn't that how it works?
Not in this case. Her body's trying to do what you refuse to. Get the baby out and save itself.
Patient's transminases are 10 times normal. Her liver's on the verge of shutting down completely.
A torch test could...
We don't have time for more tests. We have to terminate or she'll die.
What do you think House would do?
House wants to terminate.
I mean, if he didn't, if he shared my position, what do you think he would do?
He wouldn't share your pain. He'd be objective.
Right. He would prioritize his problems.
He'd terminate.
He wouldn't be afraid of screwing with her lungs if there was a bigger issue.
There is no bigger issue. She needs her lungs.
Not right now. She's already on a respirator. The machine is breathing for her. I can do whatever I want to her lungs. If you're playing catch in the living room and you break your mother's vase, you may as well keep playing catch. The vase is already broken.
Yeah, except that room can't breathe without that vase.
Putting her back on corticosteroids.
His lungs are still 2 weeks away from being viable.
But big enough for a diagnosis.
These tissue buds are new. Could indicate bronchopulmonary sequestration or diaphragmatic eventration.
I was thinking bronchogenetic cysts or bronchial atresia.
Maybe lung lesions. We're gonna do open fetal surgery. Open the uterus, cut out the fetus so we can look around. I know you can't talk, so I need you to look petrified if you consent.
The umbilical cord won't be cut. During surgery, your body will basically serve as the baby's heart-lung machine. We find what's wrong and we fix it, if we can.
Don't lower expectations if you want them to do something.
She should know what she's facing. This is incredibly dangerous. It risks both your lives. The only reason why we're suggesting it is because there's nothing else we can do.
So my kidneys, liver, and lungs are all fine, just like that?
Just like that.
That's amazing.
What's amazing is how blonde your baby's hair is.
My baby?
You know, the thing in your belly that tried to kill you.
You've never called him a baby before.
Any pain?
Nothing I can't deal with.
You can only get out of bed to pee, poo, or shower, and absolutely no sex. So stop flirting with me.
Sorry. So this really worked. He'll be normal.
You call being born twice normal.
Hey, thank you.
Don't thank me. I would have killed the kid.
I thought it was done.
Yeah, like I'd let anything happen to you. You're the only one who could fix the generators. 1, 2.
Kate! Kate, are you okay? Are you okay? Hey!
I need help.
Who am I supposed to get?
Something wrong with Coma Guy's cable.
He seems fine with it. Your patient is an adjunct faculty member here, but currently... the budget committee voted to charge for cable in the patient rooms.
Slippery slope. Today we withhold porn, tomorrow it's clean bandages.
Talk to Carlson in Durham. He runs the budget committee. After you look at this.
After you talk to Carlson Maybe I'll...
The patient is trapped at the South Pole.
Any possibility of evacuating her?
Well, that wouldn't be any fun. And for the next 2 months, winds make it impossible to fly anything in or out.
Could be appendicitis or a gallstone.
Or a kidney stone.
That wouldn't be any fun. If it's appendicitis down there, her appendix ruptures, she dies, there's nothing we can do. If it's a stone, she takes pain meds, stone passes, there's nothing we need to do.
Could be a struvite kidney stone.
Most kidney stones are calcium and benign. Why would you suspect a struvite stone?
Because he said kidney stones were boring.
It's possible. She's on birth control. Lots of sex could lead to urinary tract infection, which could lead to an infection-laced struvite kidney stone.
Excessive Antarctic drilling. Bad for the environment and the ladies.
If it's a struvite stone, she needs to break it up quickly before the infection shuts down her kidneys.
This is where it gets fun. These are the supplies and medications she has available.
There's nothing here that could break up a kidney stone.
What else do they have down there?
I just said.
I don't mean medical stuff, other stuff. Some geological equipment breaks ice and rock the same way we break kidney stones. Discovery Channel. I like watching them blow stuff up.
Who doesn't? Your Chem 7 results show that your kidney function is declining. Sounds like a kidney stone to me.
The decreased function could be from dehydration caused by vomiting due to a gallstone.
You agreed that the Chem 7 would decide if it was a struvite stone.
I agreed to do the test. The results are up for interpretation. I'll redo the test in an hour when I'm rehydrated.
Have you noticed any improvements in starting the cefuroxime?
Not really. Pain's about the same.
While you're waiting, we should run another test with the geology
Taking
equipment.
the cefuroxime. She's right-handed. And she would have put the IV in her left arm. Catheter in the arm makes it hard to bend the elbow the way people do when they drink.
We have a limited supply of medication, and I'm not about to waste it.
Last I checked, she had a limited supply of doctors.
Right before I got sick, one of my crew members severed his femoral artery. He needs the cefuroxime.
Right. He called dibs.
His need is definitive. Mine is speculative.
You're breathing fast.
It's because I'm pissed off.
Lift up your chin. Show me your windpipe.
My chest hurts.
It's deviating to the left.
His right lung is collapsing.
Kate, is anyone there with you?
Sean went to the mess.
You need to call someone.
Time. Get a syringe and a needle.
Why am I doing
Shut
that?
up and look.
She could pass out. She needs
She needs to reinflate that lung. Okay, now pull out the plunger. I want you to stab yourself in your right side between the second and third rib in the mid-clavicular line. By the time we get someone else there, you'll have suffocated. Just do it. See all the good stuff that happens when you listen to me?
Means it's not a kidney stone.
Ellie prep test was negative. It's not autoimmune.
You're basing that on a test done with a paperclip. Just take the prednisone.
Either find another diagnosis or find another test.
There is one way. You take this experimental drug called prednisone. Your kidneys start working.
There is another test.
I think Foreman may have just broken up there. What he actually said was, there is no other test.
If you have an autoimmune disease, exposure to the cold should decrease your kidney pain.
If I go outside, we'll have our answer. And you knew about this.
I rejected it because if you're frozen solid, it's hard to get the needles into your arms.
How long do I need to stay out?
At least 5 minutes.
8 minutes outside would kill a healthy person. And healthy people don't suck on oxygen masks. Healthy people can pee.
I'll go get Sean and have him come with me.
Just take the prednisone.
Once I come inside.
If it's autoimmune.
Are you all right?
Oh, I'm sure she's just fine. Kate? Do you know if there's anyone down there who has a cell phone?
Drink her urine. If it has a strong, concentrated taste, it means the problem's in her kidneys. Watery taste means it's her brain.
And then you can fix it?
Let's say yeah.
How do I get the urine out of her?
We'll take a straight catheter and insert
These
it.
are your only questions? Not, is it safe? Or is there another way? Or are you out of your minds?
You wouldn't ask me if...
Wait a second. You're in love with her. That explains why you're so eager to get her naked, then have a drink. Because most guys like to go the other way around.
Why do you care how I feel about her?
Because now I know that I can get you to do anything to save her. Tell him how to tap the keg. Milk, lemonade.
It tastes kind of watery.
That's bad news.
Either increased intracranial pressure or something's wrong with her hypothalamus.
How do you figure out which one it is?
We don't do anything. You're gonna drill a hole in her skull. If she regains consciousness, it's increased intracranial pressure.
And if it's the other thing?
She'll die. But if it's the hypothalamus, she's dead anyway.
If the problem is the pressure in her brain and I fix it, is she gonna be all better?
Nope. But it'll give us more time to figure out what's wrong.
I have to get someone else. I can't do this.
You love her. Right? You'd do anything to save her.
Not this. I can't do this. If she dies because of something that I did, then
Listen. I am not going to let you hurt her, okay? Now, please. This is our only chance.
Okay. The drill bit is sterile.
Place the drill bit against the upper left part of her forehead, about an inch above the temple.
It's not going anywhere.
Bone's harder than wood. Lean into it. Skull's only a quarter inch thick. Once you're midway through, drill in shorter bursts.
Come out the other side. You've gone too far.
Okay, now what? Now what?
Let the fluid drain.
She's waking up. She's waking up.
Sean? What's going on?
Take off her socks.
I could do it.
No, I got it.
Your toe is broken.
Oh my God.
Bits of bone marrow have been leaking into your bloodstream. Those fat emboli have caused blockages in your kidney, lungs, and brain.
It doesn't even hurt.
Cold numbs everything. Does a particularly great job on the extremities.
You'll need to close the break to stop the marrow from leaking.
This one you will feel.
Will you do it?
He drilled a hole in your skull after drinking your pee. I think he's up for this.
Grab the tip of her toe with your right hand, hold the break with the other. On the count of 3, pull hard. 1, 2, 3.
Now splint your toe. You'll be fine.
Thank you, House.
Don't thank me. He's the one who saved your life.